Hey guys, welcome back to another video. In today's video I'm going to talk about sexually transmitted infection, and this is the part 2 of this video. And today we are going to talk about gonorrhea, because I had promised that I'm going to exhaust each and every disease that is sexually transmitted infection, and therefore today we are in gonorrhea. I know I've been making you to wait for the part 2 of this video, and like I have said, this is a video that I'm going to talk about gonorrhea, and it is the most trending disease right now, and therefore make sure you watch this video up to the end, and don't forget to subscribe, like, share, and if you are new here, make sure you subscribe, because we have a lot more that we are going to cover in this channel. So guys, straight away, let me define gonorrhea. Let me tell you some of the signs and symptoms, the complication that this disease can cause, and also we are going to look what can you do, or how it can be prevented, because we know that prevention is better than cure. So let me start by definition. So gonorrhea is an infection caused by sexually transmitted bacteria that can affect both male and female. Gonorrhea mostly affect the urethra of the female. Gonorrhea mostly affect the urethra of the female, and it can also affect the rectum and the throat. In female, gonorrhea can also infect the cervix. Gonorrhea is most commonly spread during sex, but babies can be infected during childbirth if their mothers are infected with the gonorrhea bacteria. In babies, gonorrhea mostly affects the eyes. Gonorrhea is a common infection that in many cases causes no symptoms. I mean, it is asymptomatic. You may not even know that you are infected with gonorrhea. Abstaining from sex, using condom if you have to do sex, and being in a mutual monogamous relationship are the best way to prevent the transmission of gonorrhea. So gonorrhea, it is just a bacterial infection that is caused by sexually transmitted infection. That is what I've just said. And if you know you have to do sex and you don't trust the other person, then use condom. And then if you don't have to do, then abstain. And also, the best thing that you can do, it is to be faithful to one partner, and also maintaining a monogamous relationship. By that I mean you must have one partner relationship. So what are the signs and symptoms of gonorrhea? In many cases, gonorrhea infection causes no symptoms. When symptoms do appear, gonorrhea infection can affect multiple sites in your body, but commonly spread in the genitalia. So gonorrhea affects the genital tract. So the gonorrhea affecting genital tract, these are the signs and symptoms that will spread, or will show, or the patient will present with painful urination. The person will come to the facility and will explain to you that he or she is having painful urination. That is dysuria. And also, let me say that urinary tract infection sometimes can have painful urination, but that is why when a patient comes to the hospital, and you have to send this person to the lab, so that you know the kind of disease you are treating. You don't base your treatment on only signs and symptoms. So painful urination can also be in urinary tract infection, UTI. But in gonorrhea also, a patient will present with painful urination. That is dysuria. So another sign that a patient will present with is pus-like discharge from the tip of the penis. So a patient will come to the facility and will explain to you, and maybe when you do your physical exam, you will see a pus-like discharge from the urethra. Pain or swelling in one testis. Yeah, pain or swelling in one testis. If you examine a patient and you touch the testis or the balls, the patient will exhibit signs of pain. Yeah, or maybe the patient will just report that when he touches the balls or the testes or the testicles, there is pain. So you will have to do other tests so that you confirm the exact disease that you are going to treat. So as we are continuing, we have specific signs and symptoms in women, and this is increased vaginal discharge. Vaginal discharge is always normal in women, but if it's increased and it has foul smell, that one we have to suspect there is an infection. Another sign is painful urination. A woman also will present with painful urination, and then a woman will also sometimes will present with vaginal bleeding, or this person will explain to you that she is having vaginal bleeding in between period, or maybe after intercourse this person is having a vaginal bleeding. A woman will present with lower abdominal pain and also pelvic pain. So those are some of the signs and symptoms that a woman and a man will present with when this person is having gonorrhea. The next thing that I'm going to talk about, the gonorrhea, because I said gonorrhea can affect the eyes, the throat, the cervix, the eyes, the rectum. So let me see how gonorrhea will present when a person is having gonorrhea and this person is having sign in the rectum or in the eyes or in the throat. So the one that I've explained there, these are signs that a person will present with when this person is having gonorrhea, and these signs will have to occur in the genitalia. So let's look at the rectum. Signs and symptoms include anal itching, pus-like discharge from the rectum, spot of the bright red blood on the toilet, or maybe if this person has gone to for long call, and also the bowel movement will also be reduced. In the eyes, gonorrhea that affect the eyes, the patient will present with pain, and mostly it affect the neonates. So there will be pain, sensitive to light, pus-like discharge from the eyes or from the both eyes. And then in the throat, signs and symptoms of gonorrhea infection include swollen lymph nodes in the neck, and in the joints, one or more joint become infected by the bacteria. And this bacteria, the funny thing about it, it can spread into the blood and you can have septicemia. I said gonorrhea is caused by bacteria Neisseria gonorrhoeae. Bacteria Neisseria gonorrhoeae. Gonorrhea bacteria is most often passed from one person to another during sexual contact, and it includes oral, anal, or vaginal intercourse. Both sexual intercourse of those sites can cause, or it can spread from one person to another. And who are at risk of getting gonorrhea? Or what are the factors that may increase your risk of getting infection with gonorrhea bacteria? Young young people are the people who are sexually active, and are the people who want to explore more, and therefore when they are the most people who are at risk of getting gonorrhea. The next group of people are those who are having new sex partner. You are having a new sex partner. I was saying having a new sex partner will increase chances of getting gonorrhea. And this is because maybe you are having a new partner and you don't know the status of this person, or you don't know how this person has been in other relationship, and therefore that one only will give you a risk factor, or will give you a risk of getting infection. The next group of people are those who are having multiple sexual partners. Multiple sexual partners increase the risk of getting infected with gonorrhea. And also when you are previous history of gonorrhea, you can get reinfected with the gonorrhea. And also if you are having HIV, if you are HIV positive, you can also get gonorrhea, because HIV and STIs are correlated. Distraction. Well, I was talking about infertility in men. Men with untreated gonorrhea can experience epididymis, and epididymis is the inflammation of the epididymitis, and this is the inflammation of the epididymis. Inflammation of small coil tube in the rear portion of the testicle where the sperm's ducts are located. That is the epididymis. And this, when you get, and epididymis is where sperms are being synthesized or being manufactured. And then when this part is infected, people can get infertility. I mean, men can get infertility out of that. And also gonorrhea can cause septicemia, and this is whereby gonorrhea has spread to other parts of the body, or has infiltrated into the blood, and therefore you can get septicemia. Septicemia is the bacteria in the blood, and then you can die. And also gonorrhea can do what? Can increase your chances of getting HIV. Yeah, gonorrhea can increase your chances of getting HIV, because HIV and STIs are related. Yeah, those are the things that I can say. So the prevention of gonorrhea is use of condom if you have to have sex with a known person, and also you should test your partner, or you should test yourself if you suspect unusual signs, because you already know the signs and symptoms. And also if you suspect those unusual signs in you are supposed to go and get tested. And also if you are a person who is at risk of getting gonorrhea, you can also go and get tested. I think that is what I wanted to say in this section, or in this particular disease. And in case you have a question, just ask it on the comment section. I will consider. I still have few audience, and therefore I can freely communicate with you. So you can ask any question, or you can tell me what you want me to talk about in the next video, and I will consider that. Let's meet in the next video. Bye.